So if you know, I've been going to Washington quite a bit. If you were going to Washington, I'd be interested to hear what would all of you say to, you know, the people there. You know, do you know that the taxpayers pick up the 72% of the costs of the Cadillac healthcare our elected representatives get? Are you all aware of that?
Don't we cover it all through taxes?
No, we pay 72% of
They pay something?
The government, I mean, we the taxpayers pick up 72%, and they pick up the balance, 30-some-odd%. We are, and as federal employees, are you all aware of this? Because a lot of people don't know this.
Generally speaking, sure.
Right, I mean, you know, because but, you know, we are paying, so they are heavily subsidized by the taxpayers. These are the same people that are, you know, denying us coverage. So if you were going to Washington, what would you say to these people about what it's like, you know, fending for yourself, or, you know?
I think you need the people who are fending for themselves and people are getting sick.
Right.
I mean, to me, it's, can go back to what I was saying before. I mean, Vietnam, the opinions about Vietnam didn't really change until people started knowing people who got sick, or got killed, wounded, so.
Well, maybe this flu epidemic is going to make us all know something that's really sick.
Yeah, exactly. You know, unfortunately, it's come to that point a lot. And you talk about Haiti, I guess. I mean, Haiti, they went through their AIDS crisis, right? So, I mean, is that kind of seen as like an impetus, I guess, for?
Well, yeah, but I think what's interesting, the lesson we can also learn from Haiti is Haiti was at 12% HIV there,
Right.
and then because of an awareness campaign, because of condom distribution,
Right.
because of education, they're down to 9%. They did that in 2 years. That's really impressive in a
Right,
country
yeah.
where people can't read.
Exactly, but I think they kind of took that look in that mirror that this country really needs to take, not to get poor metaphor, but that's pretty much the situation, I think, is that who do you know? You know, who do you know who's diabetic that has to go on Cobra, you know? So
Well, I hate to sound like such a cynic, but I mean, I really don't think people care unless it affects them directly. I mean, my own parents are like drinking the Kool-Aid and are completely like hate Obama, hate the healthcare reform, like hate all of it. And I'm like, you know that I'm about to lose my insurance, and you know, my mother, who, you know, has stood in emergency rooms with me on I don't know how many occasions. So
how do they reconcile this?
I have no idea. I just like the last 4 months while this whole healthcare debate has been going on, I can't even be with them because it gets so ugly.
But they're
that's
afraid.
really a big issue, because I think that, you know, in terms of what we need to tell people in Washington, I think there's so many horror stories out there, personal stories out there. I think there's enough in the system now for them. If they haven't heard them, then maybe I don't know, call them or something. But I think that the big issue is that people, that our electeds need to hear that this is a long-term process that we're going through. And so I want to know what's coming next, because, you know, whether or not your parents support what's going on, this system is going to keep on changing, because it's inevitable. You know, we went off the gold standard, and I'm sure there were people who thought that, you know, the sky was going to fall down and, you know, the oceans were going to overflow, but they didn't. They're just going to keep on moving along, you know. So this is one of these big transitions that we have in society. I think one of the problems in Washington is they're thinking in really, really small steps and trying to kind of like throw the football across the line, and once it's there, it's like, whew, well, healthcare reform is done. Now we can go and do something else. But, you know, I wrote a piece the other day on Huffington Post in which I made the case that this is very much like the transition, the problem of taking out big tobacco in American society. It took 40 years from the time that people stood up and said, cigarettes cause cancer and they kill you, to the time where we're banning smoking in public places, so that we can finally keep cigarettes away from children who are
We should be
6.
embarrassed about that.
I know, cigarettes, you know, keep away from kids. And I think that that's a major cultural change. It took 40 years, and we are in the beginning of the same process. I think that the big thing that we have now, after a year of the Republicans calling, you know, Obama a Marxist and a terrorist and Hitler, what we have is 40% of the American public who now recognizes there's a serious problem with healthcare. Now, and that is above and beyond everyone with a personal story. And I think that you know, with all the shortcomings that we have, I think that our elected officials really need to hear that we don't want them to quit, that we are not packing it in because they didn't give us 100% of what we wanted. We are still going to be there. We're not cynical. We're not gonna stay home and sit on our hands. We're not gonna move to Canada. We're gonna keep on fighting for them. What's next?
And we
Why
need to develop better ways to have clinicians and patients make better decisions. They need better decision support. Doctors disagree with one another about a specific treatment. The patient's supposed to be personally responsible. How the heck can they do it? You know, there aren't the tools, there's not the knowledge, you know, in a digestible way to help them make those decisions.
Yeah.
If we knew, as you said before, you know, the most cost-effective ways to treat particular conditions for particular people, and the patients knew that, and to avoid, you know, wellness too, to avoid illness, and to manage chronic conditions the best way. If we had that concrete knowledge and could get it out there, could disseminate it in a way that people could use, both clinicians and patients, that is an absolutely essential piece for a sustainable improvement in our healthcare system. Absolutely essential,
Right.
and it's not getting enough recognition.
Because doctors are afraid to have a dialogue with their patients, I think. And I think
They don't
that's
have,
why.
they don't have the time to have that.
Or they don't have the
That's
time, and they're
part of it,
afraid.
But personal responsibility is an issue that hasn't really come up. I mean, the thing is that, you know, I've worked as a provider, and it's very difficult to keep patients compliant. And now we're at a point where you have many millions of people who are unemployed and frankly don't have the means, or don't have the insurance, and also don't have the means. And besides their lack of compliance, because they just forget, or they're just the typical, you know, everyone forgets these things. They just can't afford it any longer. So I've seen patients that are splitting their drugs in half and skipping days because they can't afford the whole process of being compliant.